everyone, today we are going to discuss regarding the extrahepatic biliary apparatus. So now let's see the components of extrahepatic biliary apparatus. So we all know that the liver is situated in the right hypochondrium, and in the inferior aspect of the liver we will be having porta hepatis, and from the porta hepatis there arises the right and left hepatic duct, you can imagine, and both these right and left hepatic duct joins to form the common hepatic duct, and from the common hepatic duct there arises the cystic duct, and from the cystic duct there comes our gallbladder, and here the common hepatic duct and the cystic duct joins to form common bile duct, and this common bile duct enters into the second part of duodenum. You just imagine that this is the second part of duodenum. So here this common bile duct will be entering here, and it joins with the pancreatic duct, like pancreatic duct will be arising from here, and here it joins with the pancreatic duct, and it opens in the second part of the duodenum, and here the opening is called as hepatopancreatic ampulla. So here this forms the components of extrahepatic biliary apparatus. So here we had already read regarding the liver anatomy and liver histology in our previous video. We know that the bile is secreted from the hepatocytes, and from here the bile is getting collected from through the right and left hepatic duct, and from here it passes to the common hepatic duct and it enters into the gallbladder, and here the bile would be getting stored. Then after storage in the gallbladder, the bile enters into the second part of the duodenum. For example, if we are having any fatty food, there will be enzyme present in the wall of the duodenum that will help in the contraction of the gallbladder and pushes the bile outside the gallbladder, and this bile then enters into the second part of the duodenum, and then that causes the fat digestion mainly. So this is the outline regarding the extrahepatic biliary apparatus. So now let's see in detail. So this forms the inferior surface of the liver, and here we will be having our porta hepatis, and here we will be having the fossa of our gallbladder. This is exactly the inferior surface, and from here our right and left hepatic duct arises. So now let's see directly. So this is the exact location of hepatic duct which arises from the porta hepatis, and now both of it gets joined to form the common hepatic duct. And this common hepatic duct is around 3 centimeter, and it runs downwards, and finally it ends up joining with the cystic duct on the right side. So here we must discuss regarding the accessory hepatic ducts. We can see this accessory hepatic ducts in around 15% of population. And this accessory hepatic duct mainly arises from the right lobe of the liver, and it gets opened in 4 different areas. So one is here directly into the gallbladder, and the second one, the accessory hepatic ducts open directly into the cystic duct here, and it may get open directly into the common hepatic duct, you can see, and it may get open directly into the bile duct. So these are all the 4 areas where we can see the opening of accessory hepatic ducts. Now regarding the second component of extrahepatic biliary apparatus, that is none other than our gallbladder. So we all know that the gallbladder is a pear-shaped organ, and it is situated in the inferior surface of the liver, like this. And regarding the dimensions of gallbladder, it is 7 to 10 centimeter long, and it is 3 centimeter broad in the widest part. And the capacity of gallbladder is around 30 to 50 ml. So these things are more important in MCQ point of view. So in case of gallbladder, we will be having 3 different parts. One is fundus, which is situated in the lower part, and the second part is body of the gallbladder, and at last neck of the gallbladder here, which forms the most constricted part and narrowed part of the gallbladder, and it continues with the cystic duct above. So this image is showing the anterior view after the removal of liver, and this image is indicating the left view of sagittal section through the gallbladder fossa. So you can see the gallbladder here, and this forms the first part of duodenum, and this is a transverse colon. So here you can see in the sagittal section, this is a transverse colon, and here is a first part of duodenum behind the gallbladder. You can see the gallbladder here, and above is the liver, and here comes a pancreas, and this is our peritoneal covering, and this is our anterior abdominal wall. This is our hepatic duct, bile duct, common bile duct, and this is our cystic duct. So now, in case of gallbladder, already we know that it is divided into three parts. One is fundus, and here comes the body, and here comes the most constricted part, that is none other than neck of gallbladder, which is continuing with the cystic duct. So in case of fundus, it is situated beyond the inferior margin. Yes, you know that this is the inferior border of the liver, and this fundus is situated beyond the inferior border, and it is related to the anterior abdominal wall in front, and behind it is related to the first part of duodenum and transverse colon. You can first part of duodenum and transverse colon. You can see in this image also that the fundus is mainly related to the transverse colon here. So this is all regarding the fundus. And now regarding the body. This body mainly lies in the fossa of gallbladder, which is present in the inferior surface of the liver. And here in case of superior surface, it is directly attached to the liver, and in case of inferior surface, we will be having this blue color peritoneal covering. And this body is related inferiorly to the duodenum and transverse colon. You can see here. So this is all regarding the body. Then in case of neck, it is the narrow upper end of the gallbladder, as I had already mentioned. And here superiorly, it is attached to the liver by the areolar tissue. You can, here it is attached to the liver through the areolar tissue. And inferiorly, it is related to the first part of duodenum. You can see here. And here in case of neck, we will be having the mucous membranes. We will be having the mucous membranes here, which helps in the inflow and outflow of the bile without any obstruction. And here you can see a bulge, which is none other than Hartmann's pouch. So this dilated part of the neck is called as Hartmann's pouch, and here we can see the gallstone getting enlarged sometimes and creating the complications. Regarding the third component, that is cystic duct. This is our cystic duct. This is our common hepatic duct. In right angle between this common hepatic duct and the cystic duct joining, we can see the cystic lymph node, which is always inflamed or enlarged during the cholecystitis. So above we can see the cystic artery also, that we will be discussing during the blood supply of gallbladder. In case of cystic duct, the length of the cystic duct is 3 to 4 cm long. And inside the cystic duct, we have one special foldings, mucosal foldings, that is called as spiral valve of Hester. So this is none other than the 5 to 12 crescentic folds of mucous membrane present inside the cystic duct. And this is not a true valve, this is just a mucous membrane foldings. Now regarding the next component, that is bile duct. Cystic duct gets joined with the common hepatic duct, and there comes our bile duct. Common bile duct will be like this. And here this common bile duct will be like this, and here this common bile duct is about 8 cm long and 6 mm in diameter, and this common bile duct is divided into 4 different parts because of the presence of duodenum in front of the bile duct. So here this is the supraduodenal part, superior to the duodenum, and this part is behind the duodenum, so it is retroduodenal. And this inferior part is infraduodenal. The bile duct which enters into the second part of the duodenum after joining with the main pancreatic duct, and this is called as intraduodenal part. Here the bile duct joins with the pancreatic duct, and it opens at the hepatopancreatic ampulla or ampulla of Vater. And we already studied that it is 8 to 10 cm away from the pylorus. This is the exact surface anatomy. We had read previously while discussing regarding the pancreas anatomy. So this is our bile duct and this is our pancreatic duct. Here we will be having two specialized sphincters. One is sphincter choledochus And in case of pancreatic duct, we will be having sphincter pancreaticus. And here both of it gets joined to form the hepatopancreatic ampulla. And this sphincter is called as sphincter ampulla. So this is all regarding the different sphincters associated with the bile duct, pancreatic duct, and joining of both the bile duct and pancreatic duct in the second part of duodenum. Now comes the arterial supply. So in case of arterial supply, we will be having our abdominal aorta, and from the abdominal aorta there arises the ventral branch, that is none other than celiac trunk. Now let us talk only regarding the common hepatic artery. Common hepatic artery arises as gastroduodenal artery, and this gastroduodenal artery gives two branches. One is superior pancreaticoduodenal artery and another one is right gastroepiploic artery. As I told, the common hepatic artery is divided into proper hepatic artery and gastroduodenal artery. So this proper hepatic artery runs along the free margin of lesser omentum along with the bile duct and portal vein and enters into the porta hepatis, and there it divides into right hepatic artery and left hepatic artery, and here on the way to the liver it gives branches to the gallbladder, that is none other than the cystic artery. So the main arterial supply to the gallbladder is mainly through the cystic artery, then superior pancreatico-duodenal artery and the right hepatic artery. These three forms the major blood supply to the gallbladder. Now regarding the venous drainage. Here the superior surface of the gallbladder gets drained into the tributaries of hepatic veins. Then the rest of the gallbladder gets drained into the cystic vein, which drains into the portal vein. So this is the venous drainage. Mainly hepatic vein and portal vein forms the major drainage. Then comes the lymphatic drainage of gallbladder. So here the lymph from cystic duct, hepatic duct and upper part of the bile duct gets drained into the lymph node, which is none other than the cystic node, which is present in between the cystic duct and the common hepatic duct. This is the cystic lymph node. And here this cystic lymph nodes collect lymph from all these areas and gets drained directly into the hepatic nodes. So in case of any inflammation in the gallbladder, like in case of cholecystitis, the cystic lymph nodes are always inflamed. And here the lower part of the bile duct gets drained into the lower hepatic and upper pancreatico-splenic nodes. So now regarding the nerve supply of gallbladder. So here as usual regarding the sympathetic and parasympathetic supply, and here the sympathetic nerves arises from T7 to T9 level, and they are vasomotor in action and they are motor to sphincters. In case of parasympathetic supply, it's mainly through the vagus nerve and they are motor to the musculature of gallbladder and they are inhibitory to sphincters. And here these nerve fibers were mainly derived from cystic plexus of nerves, which receives nerve from hepatic plexus, and this hepatic plexus receives fibers from celiac plexus, right and left vagi and right phrenic plexus. So the pain of gallbladder may be referred in some other areas because whenever it travels through the other nerve plexus. So if for example, if the pain from gallbladder is traveling through vagus, we can see the referred pain, we can experience the referred pain in epigastrium. And if it is traveling through the phrenic nerve, we can experience the pain in the right shoulder blade. And if it is traveling through the sympathetic fibers, we may experience pain in the right scapula. So here for example, if the pain is traveling through vagus, we can experience the pain in epigastrium, and if it is traveling through the phrenic nerve, we can experience in the right shoulder blade, and if the pain is traveling through the sympathetic fibers, we can experience the pain in right scapula. So this is one of the clinical significance regarding the referred pain. Now regarding the functions of gallbladder. First, it helps in the storage of bile and it helps in the absorption of water, which mainly leads to the concentration of bile. So here normal gallbladder have the capacity to absorb the small amounts of bile salt and cholesterol component. So if there is any problem with the gallbladder, that may leads to the deposition of cholesterol inside the gallbladder and that may lead to the stone formation. So mainly it prevents the formation of stone by absorbing the bile salt and cholesterol up to some extent. And it mainly regulates the pressure in the biliary system by appropriate relaxation and contraction. So now regarding the embryonic development. So this is the foregut, and from the foregut, caudal part of foregut, there arises the hepatic bud, and this hepatic bud elongates cranially and it gives rise to the small bud on the right side. And here the small bud is called pars cystica, which develops into gallbladder, and this main part is pars hepatica, which develops into the liver. So this is all regarding the embryonic development. So now let us have a quick recap regarding the extrahepatic biliary apparatus. So here it arises from the right and left hepatic duct, which arises from the inferior surface of the liver from the porta hepatis. Then it gets joined to form the common hepatic duct, and from the common hepatic duct there arises the cystic duct. Both the cystic duct and common hepatic duct joins to form the bile duct, and while entering into the second part of the duodenum, it connects with the main pancreatic duct and it enters into the second part of duodenum at the hepatopancreatic ampulla of Vater. Now regarding the hepatic duct, there arises the right and left hepatic duct which joins to form the common hepatic duct, which runs downwards and it is 3 cm long, and here it joins with the cystic duct and finally forms the common bile duct. Here we can see the accessory hepatic ducts in around 15% of population, and this accessory hepatic ducts may drain directly into the gallbladder or into the cystic duct or into the common hepatic duct, or it may drain into the common bile duct. And now regarding the next component, that is gallbladder. It is present in the inferior surface of the liver near the porta hepatis. We all know that. And here it is 7 to 10 cm long, 3 cm broad and 30 to 50 ml in capacity. And this is more important in MCQ point of view. And this gallbladder is divided into 3 parts. One is neck, then body and fundus. So now regarding the fundus, which is situated beyond the inferior border of the liver, you can see here, and it is related anteriorly to the anterior abdominal wall, and here we can see the 9th postal cartilages. And now regarding the body of gallbladder, so this body, like anteriorly it is related to the fossa of liver, and posteriorly it is related to the peritoneal covering, and we can see the transverse colon and the duodenum behind of liver. So in case neck is the narrowest part and it continues superiorly as cystic duct, and here with the liver it is connected through the areolar tissue, and inferiorly it is connected to the first and second part of duodenum. And in case of neck we have one dilated part, that is none other than Hartmann's pouch, and sometimes the gallstone may get lodged into this part and may lead to the complications. And now regarding the cystic duct, here it is, and it is 3 to 4 cm long, and inside the cystic duct we will be having spiral valve of Hester, which is none other than 10 to 15 crescentic folds of mucous membrane, and here you can see the cystic lymph nodes. And next component, that is bile duct, and it is 8 cm long and 6 mm in diameter. And here, based upon its relation with the duodenum, it is divided into 4 parts. One is superior part is supraduodenal part, and the part which is behind the duodenum is retroduodenal part, and the part which is inferior to the duodenum is infraduodenal part, and the part which is entering into the second part of the duodenum along with the main pancreatic duct is called as intraduodenal part. So here you can see special sphincters. So in the end of bile duct we will be having sphincter polytocus, and in case of pancreatic duct we will be having sphincter pancreaticus. Both get joined to form the hepatopancreatic ampulla. There we can see the sphincter ampulla. So in case of arterial supply, there is a cystic trunk from where the common hepatic artery arises, and this common hepatic artery divides into proper hepatic artery and gastroduodenal artery, and this gastroduodenal artery divides into superior pancreaticoduodenal artery which supplies the gallbladder, and into right gastroepiploic artery. And here this proper hepatic artery gives branches cystic, and this proper hepatic artery gives a branch to the gallbladder, that is none other than cystic artery, which forms the major arterial supply, and it runs above in the lesser free margin of lesser momentum, and it divides into right and left hepatic artery, and this right hepatic artery also forms the major source of blood supply to the gallbladder. So in case of lymphatic drainage, the superficial part of gallbladder gets drained into the hepatic vein, and the rest of the gallbladder drains into the cystic vein. The cystic vein then drains into the portal vein. And now regarding the lymphatic drainage, here the lymph from cystic duct then a common hepatic duct, and the upper part of bile duct drains into the cystic lymph node, and this cystic lymph node drains directly into the hepatic nodes here, and the lower part of bile duct gets drained into the lower hepatic and upper pancreatico-splenic nodes. So now regarding the nerve supply, sympathetic plexus is through the T7 to T9, which is vasomotor in action, and it is motor to the sphincters. And here in case of parasympathetic supply, it is motor to the muscles of gallbladder, and it gives inhibitory action towards these sphincters. And here the nerve fibers are arises from different plexus, mainly from cystic plexus, which derives fibers from the hepatic plexus, and this hepatic plexus derives nerves from celiac plexus, right and left vagus, and right phrenic nerves. So here, because of the involvement of different plexus of nerves, if there is pain in gallbladder, it may travel through the different nerves and it may produce referred pain in some other parts of our body. So for example, if we are having pain in the epigastrium, the pain is traveling through the vagus, that's why it is causing pain in the epigastrium. So if the pain is traveling through the phrenic plexus, then the pain we can see in right shoulder blade, and if the pain is traveling through the sympathetic fibers, we can have pain in the right scapula. So now regarding the functions of gallbladder, main function is storage of bile, then absorption of water, and which leads to the concentration of bile, and it prevents stone formation by absorbing the cholesterol and bile salt, and it helps in the pressure maintenance of the extrahepatic biliary apparatus by contraction and dilatation of gallbladder. And embryonic development. Here in case of foregut, caudally we will be having the hepatic bud, and this hepatic bud gives rise to the small cyst in the right side, that is pars cystica. So this pars cystica develops into gallbladder, and the main part is pars hepatica, which develops into liver. So this is all regarding the extrahepatic biliary apparatus. So if you have any query regarding this discussion, you can comment below, or if you have any topics for suggestion to be discussed, that can also be commented below. Thank you so much and happy learning with us.